We are Gabriela Tavares, Claudia Yatzan, Mileni Valdez, Meraris Tolentino, Samik Shah, and we are presenting pyelonephritis.
Hello, my name is Samik, and I will be going over the definition of pyelonephritis. It is a bacteria of the kidneys. Pyelonephritis can be acute or chronic, and it is most often due to the absence of bacteria from the bladder up the uterus to infect the kidneys. It's the infection and inflammation of the kidneys due to a bacterial infection.
Mileni Valdez, and I'm going to be talking about the epidemiology of pyelonephritis. In the United States, pyelonephritis is found at a rate of 15 to 17 cases per 10,000 females and 3 to 4 cases per 10,000 males annually. Pyelonephritis has a mortality rate of 10% to 20% if it's accompanied by bacteremia. Bacteremia is the presence of bacteria in the bloodstream. Even though young sexually active women are the most affected by pyelonephritis, infants and elderly are also at risk due to abnormalities in anatomy and changes in hormones. Pregnant women can also be at risk, and 20% to 30% will develop pyelonephritis, usually during the second and third trimester. Even though pyelonephritis has no racial predisposition, various studies have shown that pyelonephritis is more prevalent within Asian populations as compared to Caucasians.
Hi, I'm Gabriela, and I'll be talking about the risk factors. So one of the first ones would be having a weakened immune system. Another one would be having a urinary tract blockage, having a condition that causes urine to flow the wrong way, and having a damaged nerve around the bladder. Another one is also being a female, because females have a shorter urethra than men, so it's easier for bacteria to travel.
Hi, my name is Meraris Tolentino, and I will be talking about the physiopathology of pyelonephritis. As we know, pyelonephritis is a bacterial urinary tract infection that affects the kidney parenchyma. This is the cortex and the renal pyramids, the calyces, and the renal pelvis. We also know that it has two forms, chronic and acute. Acute is a sudden inflammation caused by bacteria that primarily affects the interstitial area and the renal pelvis, and less commonly the renal tubules. And chronic is a continuing pyogenic pus-producing infection of the kidney that can progress and become a chronic kidney disease. And some cases are associated with stones, thin parenchyma, and obstructions. Both forms can affect one or both kidneys. The infection spreads from the bladder to the ureters and then to the kidneys, like in vesico-urethral reflux. Due to this, bacterial reflux to the intrarenal tissue may colonize and infect within 24 to 48 hours. Other infections may result from procedures like catheterization, cystoscopy, urologic surgery, rarely from hematogenic infections like septicemia or endocarditis, and finally from lymphatic infection. It may also result from inability to empty the bladder, urinary stasis, or urinary obstruction due to tumor strictures or benign prostatic hyperplasia. Most UTIs are caused by enteric gram-negative organisms and can be symptomatic or asymptomatic. Here we have an image of the phases of the pyelonephritis infection. The early phase is called the edematous, and we will observe narrow calyx neck, focal parenchyma scarring. Progressive phase is the second phase, and we will observe progressive scarring of the parenchyma. And in the final phase, we will observe atrophied parenchyma. There are some specific forms of acute pyelonephritis. Diffuse suppurative pyelonephritis is caused by a bloodborne infection in the kidney, typically caused by Staphylococcus aureus, and the source of infection is often nosocomial. In the image, we observe the subcapsular surface of the kidney, and it's showing numerous whitish yellow abscesses. Emphysematous pyelonephritis is a severe suppurative infection of the kidney accompanied by gas formation in the pelvicalical region and the kidney parenchyma and sometimes the perirenal tissue. Here we have a CT image as a coronal reconstruction that shows gas in the parenchyma of the left kidney. A specific form of chronic pyelonephritis is xanthogranulomatous pyelonephritis. This is a rare chronic debilitating inflammatory condition of the kidney characterized by focal or diffuse destruction of the kidney. The pelvis is dilated and often contains calculi, necrotic material, and pus. The papilla is frequently lost, occurs more often in adult females. In the image, we can observe friable yellow tissue that surrounds the dilated calyces. Other complications can include acute sepsis, acute kidney injury, and renal scarring. When these secondary conditions develop, acute pyelonephritis can become fatal, and in chronic pyelonephritis, proteinuria, focal glomerulosclerosis, progressive renal scarring, and pyonephrosis.
Now I'll be talking about clinical signs and symptoms. So some of them would be pus or blood in the urine, nausea or vomiting, fevers and chills, frequent urination or the strong persistent urge to urinate, burning sensations when urinating, and having back, side, or groin pains.
Treatment. To best treat pyelonephritis, it is important to take a urine sample, even though E. coli is the bacteria that mostly causes these infections. Outpatient care is recommended to healthy and non-pregnant patients and those that have uncomplicated cases. Antibiotics are given orally, and those include fluoroquinolone, cephalosporins, or trimethoprim, and sulfamethoxazole. Analgesics and or antipyretics can also be given, like ibuprofen, aspirin, or acetaminophen, which can help reduce fever and help reduce inflammation if those symptoms are present. Inpatient care is also recommended to patients that have underlying health conditions, including diabetes, those that are elderly or those that are very young, like children, and patients that have complicated cases. In that case, intravenous antibiotics are given. Examples include piperacillin, tazobactam, fluoroquinolones, cefepime, and vancomycin. And vancomycin is given to those patients that are allergic to penicillin. Intravenous hydration and electrolytes are also given to patients to ensure that they do not become dehydrated and to help flush out the bacteria from the kidney. Lastly, complicated and persistent cases may require surgery. Surgery is used to remove blockages like kidney stones or to correct a kidney defect. A block nephrectomy can also be done. The surgery can also drain an abscess and can correct surrounding organ defects. For example, if a patient has vesicular reflux, an endoscopic injection can be performed, and if not, an open ureteral implantation can be performed. Lastly, a nephrectomy can be performed with the hopes of having a renal transplantation done.
Okay, so our clinical case. A 15-year-old diabetic lady presented with bilateral leg pain, fever, chills, headache, vomiting, and with incontinence for the past 3 days. She has been treated with intravenous antibiotics but hasn't improved. Because pyelonephritis is a common renal manifestation in patients with diabetes, her physician ordered a urine analysis. A urine analysis is a test of urine which is used to detect and manage several diseases or disorders, including kidney disease and tract infections. Her urine analysis showed a high blood cell count and bacteria. Her doctor ordered a urine culture to determine what type of bacteria it might be. 2 days later, the results were ready and showed that she has Escherichia coli bacteria, which is the most common bacteria for pyelonephritis. Due to her results and symptoms, the doctor confirmed she has pyelonephritis.